It is very important to get an early surgery after a hip fracture in the elderly. The most important reason is because we want to avoid secondary complications. When an elderly succumbs to a hip fracture, he or she will be bedridden and they can't walk. And this can lead on to significant complications such as chest infection, bed sores, deep vein thrombosis, and many more, including urinary tract infections, depression, delirium, and many more. Therefore, if an individual succumbs to a fracture, particularly in the hip and in the lower limb, the main goal is to get an early surgery so that you can restore function and mobility. By allowing the patient to sit out of bed after the surgery, you can prevent a lot of these complications and therefore have a good outcome. Of course, if the patient has no other contraindications for surgery, then surgery will certainly be ideal, and time is a very important factor because elderlies can defunction very rapidly. So if there is a hip fracture in an elderly, get a thorough clinical examination, and early surgery is advisable so that you can restore function and mobility and at the same time minimize the risk of secondary complications. Thank you.